everybody. My name's Tyler. I'm going to be talking about competence to make treatment decisions. Competence to make treatment decisions is largely based on the choice of the patient, or whether or not they can make their choices. So things like, can they refuse medical treatment? Can they be forced to receive treatment? So in the picture, you see a person, he's running from the ambulance. Can he actually be chased down and forced to undergo treatment? It all comes down to competence to make treatment decisions. And how is that competence determined? It's largely based on one's ability to have informed consent, or to give informed consent, Why is informed consent required? It promotes individual autonomy, it encourages rational decision making, and it protects the safety and welfare of patients and research subjects. Obviously, people need to have a say in their medical treatment. You can't just be dictated and told what you're going to do, and just because a doctor says you're going to do it doesn't mean you have to do it. People have to have the ability to deny treatment and make their decisions. It's their own body. However, if a person is not of sound mind or they can't make those decisions, then that's when it becomes an issue, and that's where informed consent comes into play. There's 3 elements to determine informed consent, and that includes disclosure, competence, and voluntariness. In order to be informed, you have to have the capacity to be informed. And these 4 factors are largely what determine if you have the capacity to be informed in order to give informed consent. So a person's ability to evidence a choice. Can the person make a decision? The ability to understand relevant information. Can they understand the information presented to them? The ability to manipulate information rationally. Can they process the information weighing the pros and cons in a rational manner? And the ability to appreciate the situation and consequences. Can they fully comprehend the situation and the consequences? And that last one right there is actually one of the reasons minors can't participate in their own medical treatment decisions, because, as we all know, minors are not fully developed neurologically, and they don't have the cognitive processes available to fully comprehend the situation and make the proper decisions. So that's why they're determined to not have the capacity to be informed, and therefore can't give informed consent. So back to the elements of informed consent. The first is disclosure. This is where you would discuss the nature of the procedure, risk, rewards, alternative treatments, and consequences if not done. The person, like I said, they have a right to be included in their medical treatment, and they need to be informed of what's going on. They need to know what procedure is going to be happening, the risk, rewards, and so on. The second element would be competence. And this is a big one. Most people are presumed competent unless they're a minor, they're elderly, or they present with some kind of mental defect. It's most commonly an issue when treatment is refused. And I've seen this myself working as a paramedic. People come to the hospital or they call 911, they have a life-threatening situation or a potentially life-threatening situation, but yet they don't want to have treatment. Now you have to have their competences in question because they're refusing a treatment that most people of their sound mind would usually agree to. There's different tests to determine if someone's competent, and there's no standardized system in place currently. So a lot of EMS systems, for example, will say A&O times 3. Is the person alert and oriented times 3, which would be their person, place, and situation. So you ask the person, do they know their name? Do they know their birthday? Do they know where they're at? Do they know what's going on? Based on those questions, for the most part, if they answer them properly, then they would be determined to be competent, alert and oriented, and able to make treatment decisions, for the most part. It's hard for that test to be objective when determining competence, because the clinician's always going to believe the treatment's necessary. So if a person doesn't want to go through the treatment, now you have that objectivity issue come into play, where maybe the provider is going to say they're not alert and oriented in order to force treatment. Again, there's no clear standards on this. It's all at the state level, and really it's at the local level at different agencies and according to protocols established by doctors. The third element is voluntariness. And basically this is a legal versus a mental health issue, meaning people that are involuntarily committed, so Baker Act people, people that are in prison, Just because they are institutionalized doesn't mean they lose all their rights to determine what treatment they receive in medical terms. And that's an issue that's been debated. We'll get into that later in the slides, but that's what voluntariness is. Just because they voluntarily admit themselves to the hospital versus being involuntarily committed, people still have rights to choose what treatment they undergo. The right to refuse psychotropic medication, this even goes beyond the legal requirements for consent to treatment. We have three main cases that kind of started this discussion. The first two, Rennie versus Klin and Rogers, the Commissioner of Mental Health. These started on how hospitals and other institutions were treating people that were committed, and it started leading to court decisions at the state level recognizing the right to refuse psychiatric medication. Well, that later, we kept having these different cases at the state level, so it eventually got to the Supreme Court level, where it was Washington v. Harper. And in Washington v. Harper, there was a state prison policy that permitted involuntary medication, which is where someone was forced to be given medication, if a 3-person committee concluded that refusing the medication, the prisoner would, if he suffered from a mental disorder and was either gravely disabled or posed a substantial risk of serious harm to himself or others, then they could be forced to have medication if that 3-person committee determined so. The prisoner challenged the law, the policy, and eventually made it to the Supreme Court. They determined the policy could stand. However, they determined that as long as antipsychotic medication is being administered for no purpose other than treatment, a prisoner cannot refuse it. And that was kind of the benchmark right there, was no purpose other than treatment. So it suggests a competent individual should be able to refuse medication if it's a purpose other than treatment or to someone who is not dangerous or gravely disturbed. So basically, they can't just go and give you this medication because they want you to calm down, because it's not exactly a treatment purpose. But again, it's objective because you've got a 3-person committee in a prison, and these 3 people could get together and say whatever they want, determine the person's a threat to himself or others, and basically force you to get the medication with no repercussions. I have 2 links I posted for YouTube, and one talks about the capacity to be informed, and the other is informed consent. And they're 2 short videos, they're like 2 minutes. For the discussion question, I've got a 53-year-old male has been admitted to the hospital for chest pain, shortness of breath, general weakness. Upon examination, it is determined that the patient is having a heart attack. The man is alert to his surroundings, understands the situation, and presents as a competent, rationally minded person. However, if the patient does not receive the intervention recommended, he will die within a rather short period of time. As the on-call psychologist, you're called to evaluate this male and determine his competence to refuse treatment. Using your own state laws, can you force this person to undergo life-saving treatment for his heart attack? If so, what legal avenues, justifications will you use? And just to conclude, that's the type of stuff right there where the person's right to make treatment decisions comes into play. If a person's suffering a life-threatening event and the doctor says, hey, any person of a normal sound mind would accept treatment, I don't think this person actually should have the right to make treatment decisions, because I think they are not of sound mind anymore. I think they have no capacity to be informed, and therefore I'm going to place them under a mental health hold and force them to undergo treatment. Those are certain things that happen all the time, and I've seen them myself, where people are actually forced to undergo treatment. So, being that there are no laws, this is all a state law, or state level type thing, a person's competence to make treatment decisions is largely going to be determined who's on the scene of the situation, which doctor is working at the hospital they go to or the facility they're admitted to. There is unfortunately no national standard or no federal law that I'm aware of, that I've seen in my research, that conclusively determines whether or not a person has certain rights based on certain guidelines to make treatment decisions. It's basically down to the provider, what they determine, and that's what determines if the person is actually competent to make treatment decisions or not. I don't know if anybody has any questions make some comments, message me on the email. Hope you enjoyed my presentation. I look forward to seeing everyone else's. Thank you.